A root canal is a treatment to alleviate the tooth from pain. A root canal is normally caused by infection in the tooth, usually, sometimes trauma as well to the tooth. Some people come in with football accidents or jet ski accidents, and sometimes even just a knock by their kids can potentially kill the tooth, and then the tooth will need a root canal to be saved. So usually patients come in with a toothache, maybe some swelling, either on the gums or on the roof of their mouth. Usually it's to do with decay on the tooth, and the infection has gotten into the tooth and it's causing quite a bit of grief for the patient. So when we do root canals, we clean out the infection from the tooth and we dress it with antibiotics and anti-inflammatories. So it gets rid of the pain for the patient, reduces suffering, and then we actually able to then save the tooth to prevent the patient from needing extraction. Root canals, we can use that to fix pain, swelling and infection. And the main purpose here is to keep the tooth needing it extracted. Keeping a tooth is what we always would recommend for the patient. And that's a general consensus for dentistry overall, because missing a tooth can have long-term negative effects on the whole mouth. Other teeth will start to move, trying to cover the missing gap. There will be bite problems, can cause cracking on other teeth, and eventually there will be more tooth loss due to the one missing tooth to begin with. So that's why we try to save teeth whenever we can. Of course, when the tooth is unrestorable and we absolutely cannot save it, then we have to have it extracted. The first thing that we do is to alleviate the pain. So we get into the tooth, we clean out the infection as much as we can, and then we dress it with antibiotics and anti-inflammatories to kill as much bacteria as possible within the tooth. Of course, we close the tooth up so the patient can still use it to eat, and it still looks like an intact tooth. After that session, we get the patient back. After 2 weeks, we open the tooth back up again, and we fill it with a cement almost. And we use multiple layers of it, so that way bacteria is going to find it very difficult to get in the tooth again in the future. So that way the tooth stays clean inside, the infection stays away from the roots of the tooth, and we put a crown onto the tooth afterwards so the patient can function freely with the tooth. Recovery with root canals usually involve a day or two, at the most. We rarely have patients coming back complaining of substantial or long-lasting pain after a root canal procedure. Usually they feel much better, the toothache goes away, and they're able to eat, sleep and drink and function normally. So recovery is not an issue usually with us. Sometimes, very rarely, we do get patients needing to come back to redress the tooth because the infection was so big to begin with, but that is very, very rare. Some people come in and they don't believe in root canals. They see information on social media, they might see information on some websites on the internet, and even some documentaries. That communicates a lot of misinformation about root canals. None of those websites, studies, or documentaries actually have sufficient evidence to back up their claims. From what we know currently, root canals are a very safe and a very normal procedure to be conducted on the tooth. Even though the tooth is not alive anymore, it's still very healthy to have the tooth there rather than having it extracted. You don't want to be missing a tooth because it will cost you in the long run. With ARTSMILES, we do have a range of things that we can actually give to the patient to help them with any dental chair anxiety. We have happy gas. We also have anti-anxiety tablets that we can take pre-treatment, so that way the patient is more comfortable in the chair. With root canals, as scary as it may sound on some websites, it is a very painless procedure when we perform it. We give plenty of numbing, so the root canal doesn't feel like really anything scary. We have patients that fall asleep in the chair. Everything in dentistry, we don't give a lifelong warranty because it is a medical procedure, and no medical procedure in any profession would last a lifetime. So the longevity of whatever we do, including root canals, will depend on how well you look after the tooth afterwards. We need to brush and floss, as every dentist would say, and we will have to prevent decay from happening to the tooth in the future, the longer we can keep that from happening to the tooth, the longer the root canal is going to last. On average, according to studies, root canals will last you 10 to 20 years, but I've seen longer.